Migraine is one of the most disabling neurological conditions in the world, and yet it continues to be underfunded, misunderstood, and deprioritized in health policy. For many of us living with migraine, advocacy can feel overwhelming or out of reach. You might think, I'm not a policy expert, or I just don't feel well enough to advocate. But the truth is, patients like us are the heart of migraine advocacy, and our voices truly matter. Hey, I'm Adriane Dellorco. I'm the creator of Yoga for Migraine and Beyond Migraine Coaching. And today I'm honored to discuss why migraine advocacy matters with Annika Ehrlich, a family nurse practitioner and doctor of nursing practice at UCSF Headache Center, and one of the leading voices in headache and migraine advocacy in the US. She serves as board president for the Alliance for Headache Disorders Advocacy, which hosts Headache on the Hill that we're going to discuss today, as well as the president of the Headache Alliance. She's also on the Headache Cooperative of the Pacific Board and is a liaison with the American Headache Society Board. I don't know how she does it all, but she brings a unique perspective working not only with migraine patients in clinic, but also at the policy level, helping lawmakers understand the real-world impact of headache disorders. So today we will discuss what migraine advocacy looks like, why it matters, how patients can get involved in a way that works with our disease, and what Headache on the Hill is advocating for this year and how you can support their efforts. So Annika, thank you so much for being here and for the work that you do to support headache and migraine patients, both individually and on a national level.
Thank you so much, Adrienne. I'm so happy to be here and to be talking about advocacy, policy, and how that kind of interacts with our day-to-day life as headache clinicians and patients, and what we can do about things that and challenges that come up for us.
Yeah, both patients and I'm sure clinicians who are also advocates. It's a lot, but we can find ways to make it doable and make a difference. So I'd love to hear what did inspire you to get so involved in headache and migraine advocacy.
Yeah, well, I have been caring for patients with headache disorders since about 2006. So I started my nursing career here at UCSF. This is where I've spent most of my nursing career. And I also have migraine, and I've had periods throughout my life where I've, had more sort of disabling attacks and where things have been under better control. And my patient journey, everyone's journey is a little bit different, but mine definitely is reflected in the experience that a lot of my patients have. And I went to nursing school, just wanting to go to nursing school, and when I did that, I ended up in a med surg unit as part of sort of my first nursing experience, and I was taking care of patients with migraine and headache disorders who were admitted to the hospital for infusions to treat their chronic migraine, other types of headache conditions. And I was very fortunate to be exposed to a lot of really great migraine and headache teaching through the directors of the Headache Center and neurology residents, fellows, nurses here at UCSF. So we have a very strong headache program. And I think that's unfortunately, that's the experience of a lot of clinicians, is there has to be a champion in your institution who's teaching this. Otherwise, it's not necessarily sort of required teaching as part of nursing or medical education per se. And it's not always required teaching as part of, or rotations as part of neurology teaching.
Mm.
So I just was really fortunate in that I had that early exposure and a lot of really great teaching and mentoring early on, so that when I went back to school, became a nurse practitioner, and then had the opportunity to join the Headache Center here, I had already had that background and experience. So it was a really good fit. And, throughout that experience, you would kind of bump up against all of the enormous challenges that we face as patients, and also face as clinicians, and even institutions, so clinics and institutions, the things that we come up against, like for example, you're taking care of patients with cluster headache, which is an extremely disabling headache disorder, extremely painful, one of the most kind of painful experiences that a person can experience. And one of the approved treatments for cluster headache is a high flow oxygen therapy. And early on in my career, I could see, and we were running up with this problem where Medicare did not recognize that cluster headache warranted acute oxygen treatment. And so patients would get denied for this treatment. We would prescribe it. They would get denied over and over again. They weren't able to access it. A lot of other insurances follow what Medicare does and what their precedent is set. And it was a constant frustration for patients and for us on the clinic side and clinician side in trying to figure out how to get this very safe, very effective therapy to patients. And when someone is in cluster, they need it right then. We can't wait. We need to get things going right away. So, one of the things that I found out early on and that I was, a part of helping to advocate for was the getting and lobbying, essentially going to talk with legislators to make sure that oxygen was a covered therapy under CMS Medicare requirements, and that this was language that was a part of these approved conditions for oxygen therapy. So that to me was kind of this aha moment, like, oh, we can actually do something about these frustrations that we face in clinic, every day, and that our patients face. And we don't have to just throw up our hands and say, okay, there's nothing we can do. If we come together and work together as organizations and as clinicians, patients, and family members, we can eventually make a difference with some things, not everything, but definitely some things.
Yeah, and it can feel so rewarding when we do see that progress. And I think it's great for patients to hear, your story and know, like, yeah, doctors are frustrated too, and with how things are. Often patients, can sometimes put blame on doctors, but also the doctors are dealing with this system, and that it's affected by national policy, and we're all working together to change these things. I was curious, you're working on lots of boards, like what are the different roles you are doing to help and support headache and migraine advocacy?
Yeah, well, so my role, the Headache Cooperative of the Pacific, this is an organization for headache clinicians and researchers, scientists. And there's our national headache organization, which is the American Headache Society. And then we have some regional societies, and the Headache Cooperative of the Pacific is our society here on the kind of West Coast Pacific region. And we have a meeting, an educational meeting for clinicians every year. We also, part of our mission is advocacy, because this is, well recognized that headache as a field is underfunded, under-resourced, and it's something that all of us are very committed to doing. So when the Alliance for Headache Disorders Advocacy, when that was formed and started, the first Headache on the Hill was in 2007. And then the Alliance for Headache Disorders Advocacy was formed after that, because it was recognized that all of us in the field together and all patient advocate organizations really need to come together to work on policy issues to make a difference in the barriers that we're facing, and the issues around funding, the issues around recognition, issues around stigma. So HCOP, or the Headache Cooperative Pacific, was very involved with that and making sure that they were a member organization of AHDA. And you have other organizations who have come together: National Headache Foundation, American Headache Society, American Migraine Foundation. So there's many different organizations, Cluster Busters, CSF Leak Foundation. So all of these organizations that come together to work on headache-specific policy issues every year at Headache on the Hill, but also beyond. So we do more than just Headache on the Hill when there's policy issues that come up that have to do with patients with headache disorders, or clinical sort of research issues around headache disorders. We try to be involved and build coalitions with other disease state organizations and other stakeholders.
Yeah, so you guys are doing the year-round behind the scenes work to keep the
Right.
momentum going. And then tell us about how Headache on the Hill fits in, and how patient advocates can get involved. And I've also been there and participated, and but it's great to hear, as a leader and also a clinician, what it looks like for you.
Yeah. So I'm sitting on the AHDA board as part of my kind of HCOP representative duties, and then leading the board along with everyone else from our other organizations. And our main event every year is Headache on the Hill, and we're expanding. So we have been growing over the years now. Headache on the Hill initially was a group of clinicians and researchers that came together to Washington, D.C. And it was a physician by the name of Bob Shapiro, who's still involved and still comes to Headache on the Hill. And we really appreciate all the incredible work and groundwork that he's done to build this movement and build this organization and event. But he started it as an improvement project and an advocacy project through the American Academy of Neurology, and it was based off of their Neurology on the Hill event. Right. And he expanded that beyond just clinicians to really include the patient voice. So right now we're about 60% patient and caregiver voices and 40% clinician, scientist, researcher voices that are coming together. Typically it's, about 250 to 300 people that are meeting in Washington, D.C. every winter, spring, so February, March of every year. And it kind of depends on what the legislative sessions are in D.C. each year. And we go and we talk to our legislators about issues that are important to us and what are, usually when you go to these meetings every year for one of these events, you have specific asks. So what is it that is our priority issues? And usually it's kind of 1 to 3 things that you come and you talk to these legislative offices about. So these are your, your senators, your House of Representatives who are representing you in Congress. And you have the opportunity to go and talk to them about why this is important, what's important to you, and why we're advocating for the things that we are asking for. And then we go from there. And the key is to develop relationships over time with these offices. So our advocates who come to Headache on the Hill, they tend to be involved year round, sending follow-up emails to legislators' offices, participating in the virtual Headache on the Hill. So we have that every fall now, so that we're having additional contact points with the offices, and also getting involved in some things maybe even closer to home where they're advocating to have Migraine and Headache Awareness Month declared officially in their city, or lighting up their city hall purple for Migraine and Headache Awareness Month. We've done efforts like that, so it's kind of an extension of this Headache on the Hill energy.
Yeah, and just for people who are maybe considering if they want to participate in Headache on the Hill, the virtual event is a great place to start as well. If travel is hard, maybe expensive, and then you can always expand. There are scholarship funds available as well, and it as a patient, like, it is a lot in the beginning, but every year it gets easier and it's so rewarding. You meet so many amazing people, not only patients, but other physicians. And I think that combination of patient and clinician is a really special mix. And I'm really glad that both voices are represented. What are perhaps some past asks or maybe even wins that Headache on the Hill has achieved, and what's coming for this year?
Yeah. So there are some things that we're really proud of, and policy work is kind of interesting because this is really a long game, right? So there's a lot of things that we're all frustrated about and would like to change. And a lot of what we work on, so some of the things we are working on over time for a long time to see through, some of the things maybe we see if we can find an opportunity and join forces with other organizations and make something happen, because we know that will be really important for our patient population. But some really important wins that I think it is extremely attributable to our work and the kind of things that are important to our patient populations is, one is the establishment of the Veterans Health Administration's Headache Centers of Excellence. Mm-hmm. So this is something that Alliance for Headache Disorders Advocacy, Headache on the Hill, has been very strong in advocating for over the years. We know that our veterans, they really have a higher proportion of headache disorders, and oftentimes it's because it's related to service injuries that they have experienced. And there's many different types of service injuries that might cause someone to have a chronic headache disorder and need this type of specialty care. Burn pit injuries, kind of chemical injuries, blast injuries and traumatic brain injuries, all of those things can increase a person's risk for chronic headache disorder, chronic migraine developing, and needing that care. So we have, helped to secure funding, and so what we call appropriation. So this is funding for these headache centers of excellence throughout the United States, and continuing to work with the Veterans Health Administration through their overall umbrella of the neurology headache centers of excellence. And these are really centers of specialty care where veterans can receive excellent, multidisciplinary care, physical therapy, psychology services, neuromodulation devices are covered under the, Veterans Health Administration. And then, of course, neurologic specialty care and those teams.
Yeah.
So that's a huge win for us, and that would be definitely one thing. And then what we're looking towards coming up. So this year, we are very excited to continue the work around the Headache Act. What is the Headache Act? So we've gone to Washington, D.C. every year. And when we go to D.C. every year, we kind of try to figure out, okay, what issue and what can we make an impact in that would help our patient population, help our clinicians and our researchers. And sometimes it is, asking for language in a bill or an appropriation, like some funding carve away in a bill that says, we're going to protect this money for X, Y, and Z. But when you do that, you go every year, you're kind of having to introduce this over and over again. Sometimes we have champions in the House or in the Senate that already know us or know our issues. But what we're finding more and more is that disease states, when they establish their own specific legislation, that can be really effective in making sure that everyone is making a concerted effort and that the disease state itself is recognized and important for across the board with different types of legislation that have to do with healthcare, for example, or divvying up money for certain things, like the Parkinson's movement, epilepsy. They have established these types of bills, and this is called an authorization bill. And what the Headache Act would do, and we've already had it introduced in the House, and we have co-sponsors already in the House. That basically will establish a special branch of the Health and Human Services that is devoted to headache disorders. And then that includes advisory councils of clinicians and advocates and patient advocates, and then the federal agencies. And they would all have to work together in order to figure out how to best move things forward from a headache policy perspective, and think about funding within, say the NIH for headache disorders, and make sure there's this coordinated effort. So it's not asking for specific money or specific legislation outside of just this legislation to establish this particular coordinated plan within Health and Human Services specifically for headache disorders. Given
that's
how
a big deal.
Yeah,
So
that's
our
a big
first
deal.
standalone bill for headache and migraine, and hoping, that gets more and more recognition, and we can build off what has worked for other health conditions, like you said.
Yeah. And then the other things that we're working on, so this is something that we've been working on, and Adriane, I know you're familiar with, so Safe Step Act. This is something that has had a lot of support in the past, but still hasn't passed and become law yet. So every time if something doesn't pass and it's introduced into Congress, if it doesn't pass, then they have to introduce it for the next session, next Congress. So Safe Step Act has gotten a lot of support, but basically it's trying to get away a lot of the red tape and make things easier for patients to get the care they need. So like, for example, patients on something they're stable on for a while, and then they change an insurance plan, or their insurance policy plan changes their formulary for the new year, and they force the patient to try a new thing or force them off of what they've been on. That requires the insured, and the patient has the right then to say no, and the clinician has the right to say no, this patient has been stable on this medication. We are continuing this because X, Y, and Z, just common sense things that a lot of people are behind.
Yeah, and for us with migraine, most of us have had to fail so many older, less effective medications to kind of
Mhm.
get to the newer, good stuff that maybe is more expensive. And this is helping to eliminate some of that red tape. And it does sound like there's been a lot of support, and so many other health conditions, and their organizations are advocating this. So hoping that'll like finally get through soon.
I hope so too. And then our final ask is about it's called the Connect for Health Act. And this is really to enact permanent telehealth flexibilities. We know that headache patients in particular benefit from telehealth visits, that they're very effective and safe care for headache patients. And headache patients need to travel oftentimes very, very far to see a headache specialist or even just a neurologist who is able to offer headache care. So when they're thinking about this kind of specialty care, or even just, I mean, we want to advocate for telehealth for primary care too, because headache patients get care in primary care. And oftentimes they really don't feel well enough to be able to, get up, drive, go to where they need to go, et cetera. So whether it's primary care or, your headache specialist is 8 hours or more away, we want to be able to ensure as much as possible that a patient has access to that care.
Yeah, that's a great one. So useful for anything we deal with. Telehealth is a great option, and I
Mm.
hope that sticks with us. Just to wrap up, I know it's a big topic, but what's what's your sense of why headache and migraine get so little support and recognition on a national level or even just in our society?
I well, we have a lot of data to show that the stigma around migraine and headache disorders in general, but the data I think we have most around migraine, but certainly have data for other headache disorders as well. Stigma is a huge part, and we need to change that because and I think that really speaks to how important it is for patients to get involved in advocacy, to not be afraid to talk about it confidently, to advocate for themselves, and to teach others around them how impactful, how disabling headache disorders can be. We know that with migraine, that people who are really impacted by that stigma have higher levels of disability as well. So maybe they have, if you look at people who have, a higher number of headache days, it might be that the stigma might impact someone with a lower number of headache days, and they might have more disability if they really believe in that stigma themselves or are affected by it personally. So it's really important that we change the way we talk about headache and migraine disorders and people living with these incredibly disabling disorders, and advocate for the resources, funding, recognition that these disorders deserve.
Well, I hope everybody listening is feeling inspired, and also feeling like advocacy can be doable no matter where you're at. It could be going to Washington, D.C. in person. It could be sending an email, and we'll share
Mhm.
some links on how to support the work of Headache on the Hill this year. But everything counts. And with migraine, you might get involved, you might pull back. All of it helps. We kind of need to help and support each other when it comes to advocacy. So thank you, Annika, for your leadership, your tireless advocacy, and thank you everyone today. Your voice matters, and let me know if you have questions on how to participate. Thank you.
Thank you so much.